Let's discuss about another important topic, gaseous poisoning in medical legal practice. What are the learning outcomes? You have to know about examples of gaseous poisoning, circumstances of poisoning, and important autopsy features including internal and external, and also how to collect samples and important steps that you have to adhere to, and also importance of examination of the scene. With that, how do you define gaseous poisoning? It occurs when inhalation of toxic or harmful gases that lead to physiological disturbances or death. Common scenarios in forensic cases. This part it's very important to know because you might get best of 5 questions. So you have to select the most appropriate one. Sometimes it could occur due to accidental exposure in industrial or domestic settings, or deaths in confined spaces. You have to always remember gaseous poisoning. Examples: unused wells or coal mining, etc., etc., sealed rooms, right? So you should know about that fact as well. And also such gases could be used in cases of suicides or homicides as well. What do you mean by a kind of asphyxial death? It is caused by the failure of cells to receive or utilize oxygen. So this is the basic definition of asphyxial death. What do you mean by suffocation? It is due to asphyxia caused by inadequate oxygen in the environment. That means with a toxic gas, the favorable environmental gases had been replaced to have the suffocation. Right. Basis for categorizing gaseous poisoning. Right. So now we are going to categorize the basis. Actually, the classification is based on how the gas interacts with the body. There are 3 kinds: simple asphyxiants, and also clinical asphyxiants, and also just irritant gases. Now we are going to describe one by one. Simple asphyxiants means such gases are not going to react with the blood or with the body. It's just replacing the oxygen in the environment, reducing its availability for respiration. Alright, so the examples are methane, nitrogen, carbon dioxide, hydrogen sulfide. So this gas could be in another category as well as a chemical or clinical asphyxiant as well. However, death results primarily from oxygen deprivation rather than a direct toxic effect. What do you mean by an irritant gas? That means such gases just irritate the respiratory tract, causing inflammation or tissue damage, not going to react with the blood. Examples: chlorine, ammonia, sulfur dioxide. So the effect is primarily on respiratory system, leading to coughing, dyspnea, and in severe cases maybe pulmonary edema as well. Finally, the most important one is clinical asphyxiant. The definition: such gases that interfere with the body's ability to utilize oxygen at the cellular level. So when compared to the former 2 classes, now such gases are going to absorb into our body or to the circulatory system, causing certain clinical features. So what are the examples? Carbon dioxide, carbon monoxide, cyanide, and hydrogen sulfide. The effect: it causes cellular hypoxia even when oxygen levels in the blood or air are adequate, because it is going to affect our circulatory system with chemical reactions. Right. So now this is a basic chart that you can read leisurely, and importantly you have to remember there are certain overlapping gases as well, especially hydrogen sulfide. It can be categorized as an irritant gas and also a chemical asphyxiant as well, depending on the concentration. Right. So discussing about simple asphyxiant gas. The most important one is carbon dioxide poisoning. We are not going to discuss in detail. It is used in anesthesia, and also it can be accumulated in industrial mines. So there may be accidental kind of poisoning. Example, disused wells, pits, burning of lime, and breweries with fermentation. There may be emission of lots of carbon dioxide. Now, clinical features, now we are not going to discuss in detail about such concentrations. As one of the other examples for simple asphyxiants, we are going to discuss about methane poison. Methane gas is produced whenever organic material is decomposed by bacterial action in the absence of oxygen. That means in confined spaces. If somebody is, now as doctors, if you get a history of sudden collapse while working in a confined space such as unused well or cleaning of a cesspit and something, as you can see here, now you have to think about methane poison or gaseous poison. It is a colorless, odorless, tasteless, flammable gas that is widely distributed in nature as well. Moving on to the second category, irritant gases. That means such gases are going to just irritate our bodily systems, right? So there may be local effects and also internal effects as well. Burns on the skin, conjunctivitis and tearing, hair and clothes bleaching effect. Moving on to the internal findings, pharyngitis, laryngitis, tracheitis, bronchitis, bronchioles. There may be bleeding and also effects of wheezing as well. For alveoli, with inhalation there may be alveolitis and also effects of bronchopneumonia as well. Just irritation, nothing much. Moving on to the clinical asphyxiants. So what are the best examples? Carbon monoxide and cyanide gas and also H2S as well. Moving on to the details much, which toxic substances are released in a fire. Now, we always get certain accidental fires. As doctors, we get clinical cases and also postmortems to be handled. Now, you can understand this is a good instance where you get lots of toxic gases because of the burning of artificial substances, etc., etc., right? So now there may be asphyxiant type of gases such as carbon monoxide, carbon dioxide, hydrogen cyanide, and also such as irritant from the irritant class chloride, hydrogen chloride, oxides of nitrogen, acrolein, phosgene, right? So there may be lots of substances there. So as doctors, you have to know the possibility is gaseous poisoning in such cases. Moving on to the carbon monoxide poisoning. Now it is termed a silent killer. We are going to learn it soon. It's a clinical asphyxiant. Carbon monoxide also an odorless and also rapidly absorbed when inhaled combined with Hb to form carboxyhemoglobin. The affinity of carbon monoxide for hemoglobin is 250 to 300 times than oxygen. Now you can understand it interferes with the oxygen and carbon dioxide transportation. And also, since it's a colorless, odorless gas produced by incomplete combustion of carbonaceous material, so in case of house fires, there may be lots of carbon monoxide gases causing lots of hazardous effects. And blood levels of carbon monoxide is important to know. Now I am going to explain it simply. Now, in a normal person, up to 5% there may be carbon monoxide. However, now imagine if somebody is going to be in polluted environment such as coal workers and also police officers who are doing traffic things, traffic control, all right. So now you can understand, so such environments are polluted. So in such people, the level of carbon monoxide can be increased up to 10%. All right, but it's normal for them. However, when the concentration reaches up to 50%, now severe poisoning with death is the result. Now you can understand up to 5% could be in any person, up to 10% in polluted environment. And also now you have to understand up to that means if the carbon monoxide concentration is going to go up to 50%, that means it is a fatal level. Right. Now sources of carbon monoxide. Now you have to understand motor vehicle exhaust gases with incomplete combustion, there may be lots of carbon monoxide. And also with domestic appliances, there could be production of carbon monoxide in case of gas refrigerators, gas clothes dryers, and water heaters, where they are going to use different kinds of fuels. And also a structure fire, as we have described earlier, house fires still can produce lots of carbon monoxide, and industrial process also to be emphasized here as well. Right, so this is a bit of an explanation. So what is burnt? Common fuels such as gas, kerosene, charcoal, wood or petrol or diesel, right? So with incomplete combustion you can get carbon monoxide. And also what are the sources? As I have example, poorly ventilated rooms during fuel burning, running vehicles or generators in closed spaces, blocked chimneys or exhaust systems, kerosene or charcoal heaters used indoors, faulty gas heaters. Now you can understand how we can get carbon monoxide causing silent deaths. Sources we have described enough, and this part is important to know. That means a driver with effects of carbon monoxide may be mistaken to be drunk. So what does it mean? That means if a person is under the influence of alcohol, you experience certain clinical features. That means with the effects of carbon monoxide poison also the same clinical effects will be there. So we have to know about this fact, because this is going to be questioned in your MCQs. Another aviation industry and coal power plants, you can understand lots of poisonous gases. Circumstances mainly suicidal and could also be accidental as well. What are the post-mortem features? Right, so frequently you are asked about post-mortem features due to carbon monoxide poisoning. So adequate history mostly indicates carbon monoxide poisoning, and you also have to understand that carbon monoxide with carbon monoxide poison you get a different color change. That means color change could be seen as hypostasis or as the change of color, mucous membrane, and also muscles and blood. Right, so now this is very important to know as a post-mortem feature. So now it is described as classical cherry pink color due to the effects of carboxyhemoglobin. And also it is mentioned that when the carboxyhemoglobin concentration exceeds up to or more than 30% only, we can get this cherry pink color change. Right, so you can see very obvious red color internal organs. However, you have to remember that when a patient is anemic, right, so we can't see this obvious feature, but the person still can die with carbon monoxide poison. Right. Diagnosis, history of exposure, pink color, clinical features, and blood analysis, spectrophotometry, and also with post-mortem findings, as I have explained you earlier. Right, so autopsy findings, early features, pink color hypostasis, right? So pink color hypostasis. What are the other two conditions that you should know where you get pink color hypostasis? Are refrigerated dead bodies still get pink color, and also in case of cyanide poisoning as well. It is because of due to the hypoxic anoxic death, right? So the blood is cherry pink in color due to the excessive carboxyhemoglobin. Right, So now all I have explained you, now you can see cherry pink color hypostasis and also the color of the dead body, mucous membranes, tissues and muscles, blood, and each and everything, you get a very pink striking color, right? And also in case of chronic poisoning, I am not going to discuss about this part. The cerebral gray matter is going to display a lot of changes. That means the brain is the most sensitive organ to carbon monoxide. How about the investigations? You have to test blood for carbon monoxide, right? So you have to get the percentage, and also in addition to that, you have to get the lungs as well. Now I am going to describe one important thing, right? So if you happen to do a post-mortem examination for any suspicious of gaseous poisoning, you have to collect lungs, right? So now you quickly open the dead body, and then we can tightly have a knot like this around the main bronchi, like this, in order not to release the trapped air inside the lungs, right? So then you are going to cut the lungs from these places, and you are going to put such lungs into nylon bags, remember, right? So then we are going to put these lungs after sealing to the Department of Government Analysis, or whenever that they can be analyzed for the gases inside the lungs. So highly theoretical, but you have to know. And also you have to understand that now in a while we are going to discuss about cyanide gas. Now cyanide gas can be produced artificially after death, but however carbon monoxide is not such a gas, and also it is considered as a very stable gas as well. As a result, even in putrefied dead bodies, sometimes we can analyze carbon monoxide to find the cause of death. So now what's the point that I am going to highlight? Cyanide is quickly destroyed, right? So when compared to carbon monoxide, it's relatively stable. Even in putrefied dead bodies, we can analyze carbon monoxide at times. Right. Moving on to the cyanide gas poisoning. So now, as you know, cyanide gas or hydrogen cyanide is highly toxic compound, as we all know. It interferes with the cellular respiration by inhibiting cytochrome oxidase, leading to hypoxia at the cellular level despite the adequate amount of oxygen in the blood. So finally, it is classified as a clinical kind of asphyxiant agent, right? So what are the sources? Industrial sources. So very important to know. Used in electroplating, mining and chemical manufacturing, right? So as a result, whenever a person comes with sudden collapse, so as doctors, you have to think about the possibility of cyanide poison. And also with the combustion, whenever a nitrogen containing substance is going to get combust, right? So you can get hydrogen cyanide, and also with certain chemical reactions, and also with certain chemical warfare and terrorism also, hydrogen cyanide is used to have fatal effects as well. The very important reason is its the level of highly toxic effect, and also it causes rapid death as well. Routes of poison, it could be due to inhalation, ingestion, and also skin absorption as well. So at this place, I am going to discuss about Medicolegal. So that means, so there should be a space here, and also Adenia palmata. So these are two plants where we get still cyanide in the seeds of Adenia palmata, and also in Medicolegal also there is another way to get the yam and ling. There are certain chemical reactions releasing cyanide. Circumstances of cyanide poisoning, yes, obviously you can understand, right? So whenever you get a question, a jewelry shop worker is found dead with obvious pink color on his body, right? So now you have to think first of all about cyanide poisoning. So it could be gas, it could be cyanide salt as well. I am not going to differentiate much, but you have to think about that possibility as well. And also biting of cyanide capsules by terrorists when captured, and also in certain cases mass suicides among religious sects, and also as accidental deaths, as we have described about ingestion of certain food items, okay, and also in laboratory accidents as well, and also homicidal actions, right? So introduced into food and drink, and also in certain parts of the country HCN is used or cyanide components are used for judicial execution, and also it had been described in the literature that in gas chambers of Hitler during World War II they have used HCN for mass killing as well. And pathophysiology of cyanide gas poisoning I'm not going to describe, right? So it, however, it leads to cytotoxic hypoxia with lactic acidosis. Right, so what's the color of cyanide? Now earlier for carbon monoxide I have described as cherry pink color. Now here it is described as brick red color. Tissues are going to get a brick red color, right? So and also the odor of HCN gas or the cyanide component. Now it has got a bitter almond smell on entering the autopsy room if you happen to open or to dissect a dead body with cyanide gas poison or cyanide poisoning, right? So and also with external examination, as I have explained you earlier with the carbon monoxide poisoning, right? So now you can think about hypostasis, and then internal organs, blood, mucous membrane. Each and every part is deeply red in color. So this is due to the effects of cyanide poisoning, right? And also now another important thing that I want to tell about is the corrosive effect is also prominent in case of cyanide poisoning as well, right? And so I have described each and everything: hypostasis, blood, muscle and in vessels, right, organs, everywhere, right? So it is due to the excessive oxyhemoglobin in the blood, right? And another important thing that I want to tell, right, so if somebody is going to ingest cyanide, there may be gastric mucosal erosion along with the corrosive effect resembling red velvety appearance that is also seen in arsenic poisoning as well, right? If you are asked to write or tell about post-mortem features of cyanide poison, right, so there may be remnants of capsule in the mouth with cut injuries to gums, tongue and buccal mucosa in case of suicidal attempts as well. And also blackened corrosive patches in gastric mucosa can be seen when fresh salt is ingested, right? So now it's obvious to know about such findings, right? How about the toxicology now? Samples for analysis in cyanide poisoning. Now there are certain points that you have to understand, right? So you have to take stomach contents, intestinal contents, urine, vomiters, gastric lavage, sometimes organs if it is blood and everything is unlikely to find, right? So and also remnants of suspected food or drink as well, right? However, now there are certain things that you have to understand. As I have mentioned you earlier, if you are going to suspect about inhalation of cyanide gas, you have to collect lungs, as I have mentioned you earlier in carbon monoxide poisoning, right? So lungs must be packed in sealed nylon bags later on, and also to send for the laboratory to analyze entrapped gases, right? Let's discuss about toxicological interpretation of cyanide. Now, I have emphasized earlier, carbon monoxide is a bit of a stable gas. However, when it comes to cyanide poisoning, it is not so. So you have to understand that part, right? So cyanide is not a stable gas. That means easily it can be destroyed. This is one aspect. And also the another aspect is it can be formed artificially after the death because of the microbial actions. So we term that aspect as spurious formation or artificial formation after death. So now you can understand. So we have to take samples as soon as possible because of the quick destruction and also the artificial formation as well. You have to add certain chemicals to prevent the artificial formation of cyanide, and also you have to preserve the sample properly, ideally in a refrigerator. So you have to interpret cyanide poisoning very carefully, right? And also another thing that I want to highlight is in all cases of gas poisoning investigations, you have to do a crime scene investigation, because in such occasions we can find certain occupational hazards as well, all right? So we can get a lot of evidence to come into easy diagnosis. Hydrogen sulfide, as I have mentioned you earlier, this is a clinical asphyxiant. Now whenever there is there are enclosed spaces, right, and also anaerobic respiration, there may be the production of hydrogen sulfide. But however, it is colorless, flammable, but smell is very obvious, so easily we can find the presence of H2S. However, now with higher concentration, now it is mentioned that the olfactory nerve paralysis will occur, and false belief will get now the environment is safe like because of the olfactory nerve paralysis. Now there are certain lots of interesting points and I am not going to describe each and everything, but the fatality definitely and clinical features definitely depend on the concentration. Now moving on to our last part, practice MCQs, simple, true or false, right? A person collapsed while cleaning an abandoned well. The possibility of toxic gas poisoning should be included. What do you think? Definitely yes, correct. Decaying organic matter emits hydrogen sulfide and methane. Yes, correct. It's mostly organic matter decaying and anaerobic decaying, methane, and also you can get hydrogen sulfide as well. Cyanide in blood is easily destroyed after death. Yes, we described it. Yes, when compared to carbon monoxide. Spurious formation of cyanide gas is seen in blood samples unless they are refrigerated. Yes, we described it, right? So cyanide easily destroyed and also artificially produced. So as a result, you have to protect the sample with additives, and also you have to refrigerate the sample as well. Cyanide gas poisoning is considered a silent killer. Yes, it does not have a color, smell, or right? So it is not cyanide gas. It is carbon monoxide is considered as a silent killer, but cyanide has got the bitter almond smell. So as a result, it is not a silent killer. So this statement is incorrect. It has to be carbon monoxide. Pink colored hypostasis is essential to diagnose carbon monoxide poisoning. No, it's not, as I have described you earlier, with comorbidities or with anemic states, right? So you won't get a lot of carboxyhemoglobin concentration, but you can still get death with the poisoning of carbon monoxide. So in this case, this is an incorrect statement. Cyanide poisoning is seen among jewelry workers as it's a substance used in this industry. Yes, you have to know about it as doctors. The bitter almond smell from a dead body is not perceived by everyone. Yes, true. It is only perceived by 20% of the population, as it is an X-linked recessive trait. Pink or red colored hypostasis is noticed in both carbon monoxide and cyanide poisoning. Yes, true. Usually we are not going to essentially tell about carbon monoxide cherry pink and brick red for cyanide, right? So as a blanket cover, we usually tell as pink or red colored hypostasis, right? House fires emit a lot of toxic gases that suffocate humans to death. Yes, definitely. Correct. Air samples from the environment are helpful in determining the manner of death, definitely, right? So that's why I have emphasized that you have to go to the scene, and also you have to collect air samples as well. In addition to that, while doing the post-mortem, you have to collect sealed lungs to be analyzed for toxic gases within the lungs. Lungs in cases of toxic gas related deaths should be packed in brown paper bags for analysis. Each and everything is correct except this brown paper. It should be nylon bag to prevent the release of the trapped air within the lungs. Cyanide ingestion causes corrosive effects of the mouth and along the GIT. Yes, true. Hydrogen sulfide toxicity is suspected in anaerobic conditions. Yes. With that, I am going to finish the lesson. Thank you.